Okay, so for the next surgery before us, which we're trying to look at how it is done, we're looking at the surgery known as a cheilectomy. Okay, cheilectomy. Okay, so cheilectomy just have to do with a bone part is kind of like outgrown. So as a bone part is outgrown, most of the times I brought the leg because a lot of people have issues with bunions. So as the bone part is outgrown, this surgery just have to do with you cutting out the bone that is outgrown or the bone that is not there, which is now causing some issues. Okay, so what we have is this. It's a surgical procedure and it's performed to remove bone spurs. You understand? Also known as osteophytes. That's from the dorsal top aspect of the first metatarsophalangeal joint of the big toe. So they mostly use it to treat what? Hallux rigidus. Do you understand? Which is kind of like an issue where you can see how what the bone part, is outgrown here. So they do this to kind of like shave it, reduce the height. So when will they use it? Mainly for hallux rigidus, which is the painful stiffness of the big toe. Especially when you want to dorsiflex. So you have difficulties with walking, with running, or wearing shoes due to limited toe motion. So there's failure of conservative treatment too. That's like you have used conservative treatment and you have not you use the conservative treatment but still didn't work. Okay, so surgical techniques: incision is made over the dorsal aspect of the first metatarsophalangeal joint. Exposure, so the joint capsule is open to visualize a metatarsal head. So resection, removal of the dorsal osteophytes, then 25 to 30% of the dorsal metatarsal head. So smoothing, that's what I'm telling you guys, it's all about smoothing that place, smoothing it, so to smooth it out. So closure, the capsule and the skin is closed and is dressed, dressing is applied. So post-operative care is you'll not be using that part of the body to bear weight like you used to, early range of motion exercises to prevent stiffness, then pain control with medication and ice, then later on there's return to normal footwear later. Okay, so there's complication of stiffness or pain, and sometimes the osteophytes could actually reoccur again. Do you understand? But that's what the surgery does.